Welcome to our very first step development program at NUH NHS Trust. I'm Sui, the project lead, and I'm very proud to introduce our course, Discover Medicare Education, which is a very unique, flexible, bespoke, and hands-on training. It offers many opportunities for you to get involved as much as you can to fulfill all your aims in Medicare education. Why do we run this course? Simply, we believe that a high-quality teacher is an extremely desirable skill to attain as a clinician. The General Medicare Council has released several documents pertaining to Medicare education, starting from outcomes for graduates. This message resonates throughout a clinician career, being repeated in the UK Foundation Program Curriculum 2021, Generic Professional Capability Framework, and echoed by Higher Education England when doctors apply for specialty training, where many specialty view evidence of teaching in their personal specification session as either essential or desirable. The newly qualifying doctors, other Caesar doctors, and doctors in training also expressed their hunger to improve their portfolio with teaching training, lists of presentation, teaching experiences, and publication. Moreover, from Medicare education providers' point of view, the undergraduate students can learn their best on the words if we are on the same page, understand their needs, understand their curriculum, knowing how to facilitate their learning and giving feedback. The learning outcome of this course is carefully set up using the Academy of Medicare Educators Professional Standard Framework. Many educational literature say the participant can learn their best by doing things in the real world with the responsibility, with well-defined learning outcomes at the appropriate difficulty, under the supervision, with immediate feedback, chance to reflect and add on reflection. So we try to provide all these elements in our course delivery. Let's talk more details about the course. This course has two main components, teaching the teachers, online virtual tutorial, and flexible experiential learning. For the teaching and teacher course, a hybrid approach will be taken. All of you will have two PowerPoint presentations of core knowledge through email. This will front-load knowledge and ensure you are primed for the interactive learning session. This presentation is one of them, explaining about the course, so you have better idea what you can expect from us and what we expect from you. Then you will have our online interactive tutorial on coming Saturday. This session will be delivered as a mixture of presentations and small group discussion. After the course, we will send you a logbook. The format of our logbook is broadly broken down into 5 domains according to the professional standard frameworks of Academy of Medicare Educator, and you can record all aspects of your teaching related professional development activities. Additionally, in completing the logbook, our team are able to issue certificates based on your involvement and ability to assess the capability as a teacher. By attending the Saturday session, you will achieve not only a teaching toolbox set up by the foundation program curriculum, but also 2 points for ST or CT training scoring. For ST and CT application, they mark your portfolio for these 4 pillars as a Medicare educator. Start with training in teaching. Depending on your level and your chosen specialty, it might vary a little bit, but the overview is more or less the same. This one is taken from core surgical training, CT1, ST1, National Selection Portfolio Station Scoring. As you can see, we have already secured 2 points for attending this interactive online tutorial. If you want to get higher points, the training has to be 2 days long and we need to provide extra training. We will provide extra training in work-based learning as being as a member of the community of practice. You can simply involve in 3 half-days of our teaching in your own available time. We run many delivering teachings across the different styles commonly used in Medicare education. You are invited to first observe and then further session to teach in a supervised environment. After delivering each session, the participants are all given constructive feedback on their performance by the supervisor and then fellow participants. These can be used as evidence for teaching training as well as teaching experience to collect your points for further training post-application. How? You are on our mailing list for teaching opportunity. I will send the dates for every week and please let me know which one you can join. I will send the teaching materials and venue accordingly. You can send, we can send only a week ahead, or if you can send your availability to us in advance, we can allocate you. For the second pillar, teaching experience, 1 stone throwing 2 birds. You have already had 2 points. If you involve more, you will get higher points and we can sign off and give the letter for 3 months commitment, 6 month commitments, etc. We understand that you will get higher points in involving designing the course. We have designed many courses. At the moment, the University of Nottingham curriculum is changed, so there are many opportunities of designing new teaching sessions. But we recommend you to join us on designing the course and tell us your ideas. We know the curriculum overview and how crowded their sessions are, so we can design the session together, which is best suited for their needs. There are many educational projects across the Trust, UMED, postgraduate team, and Trans-Simulation and Clinical Skills Center team. And the participants are welcome either to join this project or to design a new project that aims to improve a specific aspect of teaching in practice. There are many educational conferences, AME, Delivering Excellence in Medicare Education Conference, DMED, Academy of Medicare Educator, AOME Conference, and ASME, the Association for the Study of Medicare Education. ASME also published the clinical teacher. So if your abstract is chosen for the poster or oral presentation, it will be published in clinical teacher. Association for Simulated Practice in Healthcare, SP, also published the conference abstracts in BMJ Simulation Supplement before, but now I think they move on to the International Journal of Healthcare. There are other conferences depending on your interest and your specialty. Our local, the 2022 NUH Junior Doctors Conference will be on Saturday, 2nd of July, and our UMED conference will call for abstracts very soon. It is anticipated that any completed project will be presented locally and will be considered for presentation at a national or international conference and submitted for publication in a peer-reviewed journal if suitable. Publication takes time and we can guide you all the way through your process. I hope you enjoy the course as much as we do and looking forward to seeing you virtually. If you have any question, please write it down and I will answer on course day. And thank you so much for your listening.